Hello everyone. Can we give formula feeds to our baby? That is very common question asked to the pediatricians in their OPD. So let us see, can we give formula feeds to our little baby? Can we feed bottle? In one answer question is no, because we all believe in exclusive breastfeeding for first 4 to 6 months. So when to give formula feeds, when to feed by bottle is only when it has been prescribed by your pediatrician. That means when it is medically indicated. But in all other normal situations, that means you are a normal mother, your child is a normal, there is no significant perinatal illnesses, baby is sucking well, you are getting good nutrition, you are not on any particular medications. We just have to try for exclusive breastfeeding. So the next question comes, when can we give formula feeds? And before that, why you are so much concerned about bottle feeding? Why I can't give by bottle? So answer to that is, mostly when we start bottles, there is a term called nipple confusion. When your baby sucks by your breast versus sucks by the bottle nipple, the mechanism is totally different. In breastfeeding, the baby sucks on the nipple and then releases and then again sucks. So everything is guided by the baby's demand. Whereas in the bottle nipple, baby sucks on the nipple and it continuously drips over it. There is no control because whatever milk is there in the bottle, it will come. So it is a different mechanism. So we want to avoid nipple confusion at all possible cost. And the second thing is, if you remain little patient in the initial days, the breastfeeding will be well established. If the initial few days you give the formula feeds, what happens is babies are smarter. Babies know that that is the easier way to get milk because bottle feeding is much easier than the breastfeeding. And the extra formula feeds which we give is extra sweet and tasty. So they will suddenly switch to the formula feeds, and it is difficult to establish lactation or difficult to switch back to the breastfeed only. So if you are a little bit concerned, just be patient for first few days. And once the process of sucking, swallowing, and well established, you will just have a smooth journey of the breastfeeding. The next is, that is okay, we all want to give exclusive breastfeeding, but what are the situations where the doctors advise the alternative feeds or formula feeds? So let us see, when do we advise the formula feeds? If the baby is a preterm baby, that means the baby is born before term, before 37 weeks, and his demands are different. His demands may not be met by breastfeeding only. In those situations, we ask for formula feeds. Second is, if the baby is low birth weight. What do you mean by low birth weight? If the baby's birth weight is less than 2.5 kg, he is termed as low birth weight. So then again, his growth requirements, his dietary requirements are different. So in those situations also, we say, okay, you can give formula feeds as well. If you had diabetes during pregnancy, gestational diabetes, you were on medicines or diet control, there can be situations in the first week of the life where the baby may have low blood sugars. So to avoid those situations, sometimes we say that, okay, you can give formula for the time being, but once the feeding is established, there is no need for formula feeds. Infant of diabetic mother, yes, I already mentioned that. That means when you are diabetic, your babies have the chances to have low blood sugars. In certain situations where mothers are sick, mothers cannot feed their baby. They are in ICU or they are having some other medical conditions. or they are on some particular medicines which are risky when you are feeding your baby. So in these situations only, we advise the alternative feeds. Rest all other situations, we insist that you and your baby should be on exclusive breastfeeding. And that is for your not only for your short-term benefit, but your long-term benefit. Thank you and see you in the next video.